Good morning. Can you tell us who you are?
Good morning, I am Dr. Brendan Richards, Senior Dental Surgeon to the Dental Services Department.
Okay, and this week was Dental Week. Can you tell us why it is necessary?
Dental Week is the baby of the Dental Services Department. It's an outreach to the public in which we bring dental health education awareness to the communities throughout St. Vincent and the Grenadines. It is necessary because education is necessary. It is important that we bring constant and continuous awareness to the public so that they are educated as to how best they can take care of their oral health and therefore the overall health of their body.
Okay, lovely. What are some of the dental issues that dental division most wants to bring to the public's consciousness?
We want to bring to their consciousness the importance of brushing. Brushing to the extent that this is not an activity that is substitutable, that is interchangeable. It is a necessity. And so we cannot substitute the act of brushing with mouthwashes or rinses because those are superficial stuff that would just not be sufficient in eliminating the extra plaque and debris that's between the teeth and gums. The act of brushing is what ensures thorough cleaning, and so brushing will always be needed once we are referring to oral care and oral health.
Okay. During the week of activities, visits have been made to selected preschools. What factors determined which schools were selected?
We would have looked at those schools that may have not received visits in earlier periods, and so they were foremost considered. We also looked at the proximity of the schools to the different district clinics, and so based on that, we would have thought it best with our limited resources as well to see how much we can focus on those schools that may not have been touched before to receive the the education that is so much needed and the practical instructions that can come from our staff.
Okay. Are there particular dental issues that are prevalent among this age range?
Yes, often we would have rampant caries among little children, um, baby bottle caries as well, um, in cases where kids may be given a nurse bottle and they fall asleep with it in the mouth. And we want to encourage parents to ensure that they do not just brush on mornings but just before bedtime.
Okay.
And it is so important that they brush before bedtime because that's the crucial time when the mouth is at rest. Most bacteria during the night would come to full activity when the mouth is at rest. During the day, we're always talking, we're drinking, eating, so the tongue is busy and it keeps the bacteria disturbed. They never get a chance to do anything. But when we are asleep, the mouth is at rest, the tongue is asleep, that's when they act up. And if there are bits and pieces of food between teeth, these bacteria that are resident to the mouth feed on that, multiply rapidly, and then start causing disease. That's why most toothaches and other dental problems pop up mostly at night.
Okay. Lovely. Are there any other simple and inexpensive actions which can be taken to address these issues?
Simple actions is inspecting your toothbrush. When you look at your toothbrush should not just look clean, it should smell clean. So if your toothbrush looks clean but smells dirty, it is dirty. Because the bad odor is an indication of bacterial growth. How do you make a toothbrush that looks clean but smells bad actually become clean. What you do, you rinse it with water, and after you would have rinsed it so that it's visibly clean, you take that toothbrush and you insert it into a cup of hot water that has just reached its boiling point, which means it has just come off the burner. So the water is hot. And you insert the active part of the toothbrush into the cup of hot water and you leave it there for 15 minutes. That will kills all the bacteria, all the fungus, all the virus on the toothbrush. In that way, you sterilize the toothbrush. So you use a clean toothbrush to brush with. That's a simple thing we can do. In addition to that, when you're buying a toothbrush, don't go for brand names. Look for one that has a V-cut in it, which means that it is going to adapt better into the surfaces of the teeth and help to remove the stuff. If all of the bristles are on one level like this, what happens? It just passes over, because our teeth are not flat like that. They have little hills and valleys. And so if the toothbrush is all the bristles are on one level, when it goes to the tooth, this is what happens. It doesn't get in. But if it has the V-cut in it, it adapts better into the air and it helps to remove the stuff. The other thing is to brush with a dry toothbrush. You don't need to wet the toothbrush. The toothbrush will get moist because we produce saliva or spit. And so the mouth does not need any extra help. By just a dry toothbrush, you brush soft bristles, make sure that the bristles are well packed. So you're looking for a toothbrush that is full bristled, V-cut, because if you think of the toothbrush like a broom, if the bristles are all spaced out like that, as it moves, it's going to be leaving what back? Debris behind it. If the bristles are closely packed together, when it sweeps, when it moves, it's going to remove all of the stuff. Right?
Do you think that oral health affects health overall?
Definitely it does. Oral health is so linked to overall health that a sick mouth can end up causing a sick heart. An infected mouth can easily, an infection in the mouth can easily cause an infection at the level of the heart, ending up causing what we may call an endocarditis in diabetics, hypertensive patients, where their conditions are not compensated or controlled. If there is abscesses and infections between the gums and teeth, that can go under the tongue, go straight to the blood vessels, lodge at the heart, cause an infection at the heart. What happens when the heart gets infected? Remember, the heart pumps blood. If the blood at the level of the heart is infected, it's gonna pump infected blood to the rest of the body. Infects the entire system. And that person can not just become sick, they can actually die. Think of it. A person with a high blood pressure goes to the doctor, and the doctor says, let's give him a tablet, put it under the tongue. They don't swallow it. It's placed under the tongue. And within a couple of seconds, that tablet dissolves. Within minutes, you check the person's pressure and the pressure has dropped significantly. That is how linked the mouth is to the rest of the body. Straight from the mouth, straight into the bloodstream. Within seconds or minutes. So the mouth is a crucial and extremely important part of the body. It is the gateway to health. A sick mouth will end up causing a sick body.
Okay. Well, thank you so much for doing this interview. Do you have anything to say to the public in general about this week, about oral health? Anything?
What I want to say to the public is that our dental health is precious. Teeth are precious. To us, There is no smile that is complete without teeth. The health of your smile depends on the care you give to it. Your smile is determined by the position, anatomy, and function of your teeth. And your smile has a lot to do with your self image. Anyone, child, adult, teenager, that loses a front tooth immediately gets their, their, their self image negatively impacted. They're not able to smile in comfort. And so smiles are important. They are crucial for our self-esteem, our self-image, and they are priceless. You can't put money to it. So all efforts must be made to keep your teeth. Not just because they make you look good, but they also help you to speak well. They help you to chew your food well. They take the stress off the stomach. If you don't chew your food well, you're going to end up putting into your stomach food that is not properly broken down, that the stomach now has to stress itself to produce all of these gastric juices to break down what was not properly broken down by the teeth. And so you overwork your organs when you do that. We need teeth, and they're not found in the stomach, they're in the mouth. So let's help ourselves by chewing well. And if we do have missing, broken, or decayed teeth, to have them fixed. And those that have been missing, to have them replaced because they're necessary. Absolutely important. If you cannot take care well of your oral health, you would not be able to take well of your overall health. Because what you put in is what really nourishes you. And if you're not getting enough out of your meal because you have missing teeth, it means no matter what you eat, you could have the most balanced diet. It's not going to benefit you if you can't chew. And I do hope that the Vincentian community learns and appreciate the fact that God has given us teeth to smile and to be happy, and that oral health is priceless.